Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Thrombolytic therapy, we are looking at its contraindications. So there is absolute contraindication as well as the relative contraindication. So when we look at the absolute contraindications, it includes the prior intracranial hemorrhage. So in terms of the prior intracranial hemorrhage. Next is the presence of the known structural cerebral vascular lesions. So there is no structural cerebral vascular lesion. So known structural cerebral vascular lesion. Next is the known malignant intracranial neoplasms. So the known malignant intracranial neoplasm. Next is the presence of the ischemic stroke. So there may be ischemic stroke. So ischemic stroke is within 3 months. And then the suspected aortic dissection. So there is also presence of the suspected aortic dissection. And this is there is active bleeding as well, active bleeding or the bleeding diathesis. So there is presence of active bleeding. So there is active bleed or the bleeding diathesis. Bleeding diathesis. So what it does, it excludes the menses. So significant closed head trauma or the facial trauma is seen within the 3 months. So significant closed head trauma. So significant closed head trauma or the facial trauma. So they are seen within 3 months. Next, we move on to the relative contraindications. So what do the relative contraindications include? So here in relative CI. Relative CI stands for the relative contraindications for the thrombotic therapy. So it includes the uncontrolled hypertension. So you have uncontrolled. So uncontrolled hypertension. Uncontrolled hypertension is when the SBP it becomes greater than 180 mm. 180 mm and the DBP it becomes greater than 110. So this is uncontrolled hypertension. This is the relative contraindication. Next is the traumatic or the prolonged PGR. There is a traumatic as well as a prolonged. There is traumatic as well as prolonged CPR. CPR or the major surgery within 3 months or major surgery, and this is within 3 months. Next is the recent internal bleeding. There can be recent form of internal bleeding which is seen. So recent form of internal bleeding. Next is non-compressible vascular punctures. There's presence of non-compressible vascular punctures. Then there is presence of the active peptic ulcers. Then comes the current use of warfarin and the INR. So current use of what you use? They use warfarin. So there will be current use of warfarin. So you use warfarin and also the INR. INR greater than 1.7 is what you use. This is all in terms of the relative contraindication. To learn and grow daily like this, please do subscribe.